Association. We let me set the stage on here because to tell you what the kerfuffle is, I haven't used that word in a long time.
It's a good word.
I had to go dig it up.
It's underused.
It was in the backyard, 3 feet of dirt. I dug it up, cleaned it off. That's it. It's there. Kerfuffle. How are you? But set the stage here. What happened, and why is there now this problem between the State Medical Association and the State Board of Nursing?
Well, I'm going to start with...
Just raise that up a little bit.
I'm going to start with, we love nurses. Mm-hmm. We have to have nurses. The medical team is part of... So we're not against nurses. Every time I come in here, it seems like I'm talking negatively about somebody. Mm-hmm. We love our nurses. We love our nurse practitioners. But what the Board of Nursing did is they said, they lowered the standard for new nurse practitioners to begin practicing without direct supervision. What they did was they used an emergency portion of the Administrative Procedures Act to state that there was imminent peril to public health, safety, or welfare in order to diminish the amount of training that a new nurse practitioner has to have, the amount of witnessed hours of training in order to practice without someone having direct oversight. They said it used to be that if you finished nurse practitioner school, you have achieved your license. If you had not practiced as a registered nurse before finishing nurse practitioner school, you had to have 2,000 hours of a physician or a fully licensed nurse practitioner with more than 3 years of experience absolutely present in the same clinic with you while you learned on the job. They've now said
this is attending to patients or administratively or a combination.
Combination. So you're a new nurse practitioner, you've just finished your graduated, mm-hmm. and you've never seen patients clinically before in terms of making your own decisions. So for 2,000 hours, you had to have a fully trained nurse practitioner with over 3 years of experience or a physician who practiced in your same area which you're practicing in as a nurse practitioner present in the clinic at the same time that you're there.
Is that a national standard? Or
it's a Mississippi standard. Yeah. It was what we had. And then if you had practiced as a nurse for at least 1 year, you only had to have this monitored practice for 1,000 hours. So as an emergency, using this emergency authorization, the criteria which says that there has to be an imminent peril to public health, safety, or welfare, the Board of Nursing said, you know what, we think there's an imminent peril if we don't allow those new graduate nurse practitioners to immediately go out and see patients without having an experienced physician mm-hmm. or a very experienced nurse practitioner present in the clinic with them.
This pertains to advanced practice registered nurses?
Advanced practice registered nurses, which is not just the nurse practitioner that you might see at an urgent care. Yeah. It's also the certified registered nurse anesthetist or the nurse midwife.
There are so many classifications. The general public is just confused. But this has nothing to do with a registered nurse or...
No.
It has. You have to be at the level of an advanced.
This is advanced practice nurses.
What's the difference between that and nurse practitioners?
Well, nurse practitioners are advanced practice nurses.
Okay, they are the
same
thing.
Advanced practice nurses is an umbrella under which you will see family medicine nurse practitioners, acute care nurse practitioners, certified registered midwives, certified nurse anesthetist.
Dr. Horne, when was this done? When was the declared emergency?
They declared the emergency last Friday. Interesting. We've been in a public health emergency for the past 14 months.
I would think we're waning, not waxing.
So we don't understand what last Friday occurred that they said that there was an imminent peril to public health if we don't decrease the training for nurse practitioners.
Did they define what the imminent peril was?
Well, if you look at the filing that they did with the Secretary of State, they said the Mississippi Board of Nursing identifies monitored practice hours as overly restricted of the APRN practice. Now, executive-level discussions between our executive director, Dr. Claude Brunson, and some executives at the Board of Nursing, I've been told that conversation yielded an answer of, well, some of our newer nurse practitioners are having a hard time finding someone to do these monitored hours with. And so it was a matter of employment, we believe. Mm-hmm. That's what we're being led to believe. Well, that's not the charge of the Board of Nursing. The charge of the Board of Nursing is the same as the charge of the Board of Medical Licensure. It's to protect the people of the state of Mississippi and ensure that those people who would practice health medicine are qualified and well trained.
I got to ask, why would the environment change just last week as far as finding the availability of those positions to practice in compared to what happened 6 or 8 months ago during the height of the pandemic?
It escapes me. It escapes our leadership at the board of at the Mississippi State Medical Association, and I think it's a perfect question to ask the Board of Nursing. What is the immediate emergency that made you decide now is the time to decrease the level of requirements for training?
The concern I'm sure the Mississippi Medical Association has, and you, Dr. Horne, as the president of the aforementioned, is that we're going to put people in front of patients that are a little less experienced or not ready, or what?
Far less experienced. I had more experience graduating from medical school before I did 3 years of internal medicine training. I had more experience graduating from medical school than these nurse practitioners have, and they're going to be in a clinic. Now, they do still have to have that collaborative agreement in Mississippi. Now, you got to remember, just this past legislative session, the Nursing Association fully advocated for full practice authority, meaning that a nurse practitioner didn't have to have a collaboration.
Right.
And they wanted that with 3,600 hours. Now they're saying not only forget the 3,600 hours for full practice authority, we'll take 0 hours for having even direct supervision. It makes no sense.
Well, it does sound like a continuation of that effort, doesn't it?
It's kind of like the law of holes. They're digging a hole, and they want to keep digging instead of realizing they're in a hole. They want to see how low they can go with training before they say, that's far enough.
All right. First of all, is this legal to do? Because if it is legal to do, then you have there's no appeal process or anything else, is it?
Well, the Board of Nursing, I'm not a lawyer. And I think that's a fantastic question for those who are experts in state regulations. From looking at the regulation requires there be an imminent threat to public health or safety. I don't see it. So
who decides that? Would it have to be a court deciding that?
Well,
the governor